Hi everyone, Matt from Melbourne Osteopathic Clinic here. I'm here in the osteo rehab space today and I want to talk to you about shoulder impingement type pain. These are type of pains that we see in people when they lift their arms, so when they're trying to do basic things like brushing their teeth, combing their hair, etc. and they get pain across the top of the shoulder and down into the arm. Basically what's causing that is your humerus, which is the long bone of your arm, jamming into the joint above it, and so that can put some irritation through the tendons there, or irritation through some structures known as the bursa. So I want to show you a bit of a program that you can implement to help free up your shoulder. Some of these exercises you can do a lot, and others you will sort of do sparingly, and I'll explain that as I go. The first thing that you want to be mindful of, and especially if you sit at the desk all day, is where you hold your shoulders. If you really roll in through the shoulders and then try and lift it, you're actually going to impinge the front of your shoulder. So it's really important to get those shoulders back. And one of the exercises you can do doing that is a simple shoulder squeeze, where you literally think about the bottom edge of your shoulder blade there, and you try and squeeze your shoulders back and down and hold. So you'll hold for 3 seconds and relax. Okay, back and down, hold for 3 seconds and relax. And you want to do that for about 8 sets or something along those lines. Doing that throughout the day, you can literally do that 4 or 5 times throughout the day if you want. Doing it 8 times, having a rest, but really trying to open up through there. The next exercise I want to talk about is actually helping you clear the GH, so that the bone that rams into the top of that shoulder there that causes the impingement. This exercise can be painful or it can be really relieving, so you need to make that call. And so if you're finding that it's painful on you, it might be something that you need to stop, but if it's quite relieving, you can do this quite a bit. Now, you want to do this on the back of a chair or on your desk or something along those lines. I'm just going to do it on the edge of the table here so you can see it. But basically, it's really important to put your arm out straight and put your pressure straight through your arm, and you've got to maintain that pressure down. So you're holding that pressure the whole time, and that engages the muscles around your rotator cuff. And as you're doing that, all you're going to do is shuffle your weight back. Remember to keep that pressure down, okay? And then as you walk back up, keeping that pressure down. Now you might just do 5 or so of those at a time. Once again, it should be rather comfortable. If it's not, and it's quite painful, leave that one aside because it's probably doing a bit more damage than good. The other thing we spoke about was obviously the squeezes, but now we want to stretch that muscle through the front of your chest. So there's 100 ways to stretch a pec. The easiest way is to do it in a door frame or on the wall or something along those lines, where you get your arm at roughly 90 degrees. You can do it both sides of that, and then just gently push through, so you're feeling the stretch through the front of your chest. With every stretch, you should do for about 30 seconds or 5 or 6 breaths. Now, the next step of this program is about strength. Now, strengthening the back of the shoulder is really important in these impingement type issues. So I'm going to give you a couple of variations of this. You might find that it's a little bit tricky, but you can just do this on your bed or on the ground. You've got to get pretty intimate with the ground, so you'll see what I mean in a second. So I'm just going to pop my glasses off. Now basically grab a towel or something along those lines, and just lying on the floor face down. Okay, and remember, we're trying to work the back of the shoulder here. So you'll pop your head gently on that towel there, okay? Now there's 2 ways of doing it. There's a thumb ways up, where you try and lift and hold, okay? So sort of 3-second contraction. You can do it sort of like a rugby goal or something like that, where you're in that position and you lift up and hold. Or you can point your hands down, similar sort of thing, and lift up and hold. And so they're really important for focusing on contracting the muscles in the back of your shoulder and doing it that sort of way. Each exercise you want to hold for roughly 3 seconds, okay? And doing sets of 8 throughout that there. Just put my glasses back on. The next thing that we want to look at is what we call internal and external rotation. Now, if you talk about the shoulder, external rotation, and internal rotation are those movements available through there. Now, I don't want you to cheat and let your arms sort of flail or anything like that. So if you're finding that you're needing to cheat and open up that space to get that external rotation, just grab your towel and pop it in that area there, and that keeps you really honest. So using a resistance band or something like that, squeeze in at the elbow, keep your chin up, and then just gently open up through the shoulder, okay? Gently that way. Now if you're finding that pretty easy, you can then advance to a full range sort of movement where you hold your shoulder, really set that position, and gently try and pull away. So you're working the whole posterior shoulder girdle to try and get those exercises going. The other way to then do internal rotation, once again we'll get that towel again and keep me honest, is squeezing, okay? Reset that shoulder position, step away from the band a little bit, and then come across and in. Now this should feel pretty easy because your pecs are the main muscle driving this movement. It's a big, strong muscle, but you want to once again do sets of these, three sets of 8. Nice and controlled movement. So give them a go if you're having any issues. This should be something that you do at least 4 or 5 days a week if you are getting that pain on lifting your arm up. It's a really structured sequence of events which will help you clear the space in your shoulder and hopefully give you some relief through those impingement type symptoms.